So about a month ago, we celebrated the World Breastfeeding Awareness. It was a whole week of education and then trying to promote the importance of breast milk in the life of a baby. And it was insightful. If you didn't know about that, yes, it was really, really insightful. We talked about the fact that breastfeeding helps foster a bond between a mother and then her baby, as well as we all know, breast milk is free. You don't buy it, you don't have to go get the formula at expensive prices and all that. It is free. Nature has its own way of bringing it out when it is time. So that's one importance, as well as it contains nutrients, very essential nutrients for the development of a baby, especially the colostrum, which is a breast milk that is produced in the first 1 week of the mother putting to birth. It is very, very, very rich in nutrients that help in the development of the baby, right? So as well as there are certain cancers that breastfeeding exempts a woman from. Yes, right? So cancers like breast cancer, there's ovarian cancer as well, just to mention a few. So it was very insightful. But today I want us to address the breast itself. So we talked about the breast milk and how important it is and all that, but let's look at the breast. So like I always do, 2 weeks now, all the patients that I see, I try to talk to them about the breast. And I realized that unlike other parts of our bodies that so much attention is put on, the breast is one that we don't really look at that much. And I can understand. You wear a dress and it's covered and you're moving, okay? And if people would be worried at all, which came up in my conversations with my patients, it had to do with sagging breast. That's what people were really worried about, how it looked, okay? Sagging, my breast is sagging, my breast is sagging. That's where most attention was. And I can understand, because even with that, until I am naked or until I take off my clothes, you don't really know what is going on under there. So even with that, I mean, it's not a problem. As far as I can just prop it up in a bra and walk around, I'm fine. But I want us to look at the breast factor. That's what I named it. You've already seen that with the caption. The breast factor. It is very important. So I recall during my internship days, that was in about, I think, 2018, 2019, a 21-year-old girl came in, and her complaint was that her breast size had increased. She was not pregnant, she was not breastfeeding, she was not ovulating. These things can cause an increase, right? Yes, but she wasn't going through any of these, but she felt like it had increased too much in size. So she came in, and as usual, we did everything to rule out pregnancy, rule out every other thing, only for us to realize that she had a very aggressive type of breast cancer, that because of the size of her breast that she was able to notice had increased and coming in earlier, we were able to tackle it as aggressively as possible also. And today she is fine, which would have otherwise killed her if she hadn't come in because of that. So before I go into what I want us to know today, let's get the understanding that breastfeeding does not cause your breast to sag earlier than it has to. Not putting on bra. Some people believe they have to be in brassiere or whatever, however you call it, wherever you are, 24/7 in order to prevent their breast from sagging. Being out of your bra will not cause your breast to sag, and squeezing of the breast and fondling and all that would not cause your breast to sag. There are ligaments, there are muscles that hold your breast in place. God made it that way. So the weakening of these muscles and ligaments are the only things that can cause your breast to sag. And things that can cause these muscles and ligaments to weaken are: one, heavy breasts. If you have very, very huge breasts, so that's why usually their breast sags earlier, because gravity works and then pulls on these ligaments and muscles, causing your breast to sag. And then also losing weight drastically within a short amount of time can weaken these ligaments and muscles, causing your breast also even to sag. And then having multiple children can cause your breast to also sag. But no, breastfeeding will not cause your breast to sag. No, squeezing of the breast and fondling of the breast will not cause your breast to sag. No, being out of your bra, right, sometime in the day would not cause your breast to sag. Let's get on to what I really want us to do, okay? As ladies, I don't know if we even know, or if you watching me, right, know how your breasts look like. And for people who probably are married or have partners watching me, the men, it's also for you. Do you just squeeze it and just fondle it and all that? Do you know what your wife's breast looks like? Because it is only by knowing the normal, then we can tell if something is abnormal. So let's not beat about the bush, straight to the point. I want to give us some steps that we can take in order to be able to, pick up some of these things if they come up at all. So first of all, you watching me, when you're naked in your room, in the washroom, look at your breast under very good light source. So your room would do. If your bathhouse is also well illuminated, that's also fine. Look at it very well. How does your breast look like? First, you can tell by looking at it, you can tell the size. You can tell the skin around your breast, what it looks like. If you see anything that looks like the peel of an orange, that's abnormal. Your nipple, how does it look like? We have two. So you look at this and then you look at that. Is one protruding and the other inverted? All these things will give you an idea. The skin around the nipple, it's usually different from that of the whole breast, right? Look at it. Get a good look at your own breast, and then you know that, okay, this is what my breast looks like, so that if something goes wrong, you are able to see and then you pick it up as early as possible. After looking at it, touch your breast, okay? Hold it in your hands. It will tell you the size of your breast. Does it fill up your palm, or maybe it is this centimeter bigger than your palm or smaller than your palm, right? For both, so that you know the normal. And then after you've touched it, try and feel your breast. Try and feel it. Go around it, okay, all the way to your, we call it axilla, but that's your armpit. Feel your breast all around it. And then after you felt it like that, you want to squeeze it, okay? Squeeze your own breast, so that you have a feel of how it feels like. We all have a lump each. In each breast, there's a lump here, there's a lump here. Try and get it and know the size of it, how it feels. Does it move around? Is it stationary? You get that also out of the way. Then after you've squeezed your breast very well, then now you want to take your time and then massage it layer by layer. So for this one, I'd advise you kind of draw an imaginary line, 4 horizontal and then vertical. So you go like this, an imaginary in the center of it, using your nipple as a landmark. So straight like this and then this way, so that you divide it into 4 quadrants, and then you massage it from each quadrant to the other, so you don't miss if there's something wrong. I mean, there was a time when breast cancer awareness was all over the place, so we were told to do our own self-examination. We were taught some of these things, and it looks like, well, it's no longer in the system like that. But these conditions and problems are still there. They persist, right? So for the last one, before you massage your breast, usually if you come to the hospital, we ask you to do this, right? You sit, as you are sitting, you do this. The reason for that is to tense the muscles so that they hold the breast well. You are able to examine properly. So if you're alone, of course you can't do this and still examine. So you can do this. Put this arm here. When you're examining this, then you go the 4 quadrants that you divided with the imaginary line. You go from here, gently massage here and here and here, trying to feel for any lump, like an abnormal lump. We all have one, but then has it gotten bigger? That's why you have to know the normal. Or is there like another one? Some people come and they have about 4 running in there. You're able to pick all those things up and then get it. And then after everything, is your nipple discharging? Do you have any discharge? Is it like milky? It's not normal. Don't clean it and then wear your dress and go your way. It isn't normal. Is it bloody? It is not normal for all these things to be there. If you have a partner, fine. You just do this and let the person touch and feel, so that all the things that I've mentioned that are abnormal, if you should find any one of them, you quickly alert your doctor. If not, also keep doing it as much as you go to the bathroom, as much as you are lying down on your bed and watching a movie. Keep doing it so that if at all something is off, you're able to find it and then you come in earlier. Stitch in time, they say, saves 9. And so this is the doctor's quarters. If you're new here, you're very welcome. And to my returning subscribers, thank you so much for always coming back. If you're new, please hit the subscription button, and then as well as give me a thumbs up if you found value in this video. And don't forget to also hit on the notification button so that anytime I put up a new video, you would get it. And please, let's share the video. If you can't share, you have your mom in the house, your brothers, your sisters, your friends. You can talk to them about whatever it is that you learn on this platform, so that together we all build ourselves up and then the system goes on well. So this is the end of the video. I'll see you in the next one. So it's a bye for now. Yay.